Busy night of news starting with big developments in the battle against COVID-19 in Arizona. ABC 15 obtaining some new model projections that paint a pretty alarming picture as we head toward the holidays.
Yeah, and local hospitals now preparing for a challenging few weeks ahead. Let's go to ABC 15's Nicole Grigg with our top story at 10.
We know that the Arizona modeling team meets with the Department of Health weekly. Now, we got these models through sources because of how important it is to show the public what we could see by Christmas. It's a 50-page report from nearly 24 researchers with Arizona State University and University of Arizona. The model for ICU showing we will likely surpass the prior July peak of ICU COVID-19 patients a week before Christmas.
We likely will need additional support and additional help.
The chief medical officer of Valleywise says these models would coincide with what their internal data is telling them,
which would equate to, a peak if we continue on the same trajectory about, 3.5 to 4 weeks from now, which would be in that same time frame.
The concern is staffing in the hospitals essentially on their own, all trying to get doctors and nurses.
As all the systems are, we're reaching out and seeing if we can secure some of the folks with travelers and some of those levers that we were able to pull this summer. We understand, with what we're seeing across the nation, that those may not be available like we saw before.
The summer peak, we didn't have gyms, bars, and schools open. Then add in the snowbirds and holiday gatherings. This time, hospitals could have to implement crisis standards of care. That's where doctors choose who does and does not receive care.
It is a reality that we are going to have to, wrestle with and may be into that situation where we're having to implement those crisis standards of care. None of us want to get to that point.
And the modeling team with a direct message: without additional public health measures, holiday gatherings are likely to cause 600 to 1,200 additional deaths from COVID-19 by February 1st. The Department of Health Services told us last month that their main focus has been analyzing real-time data. They said that modeling was valuable before because it helped them plan processes and plan for resources. Reporting in Phoenix, Nicole Grigg, ABC 15, Arizona.